Hi, my name is Dr. Ellie Kraft, and thank you so much for joining me on my YouTube channel. So, I just wanted to say welcome here. I am going to be talking all things breast cancer. This should be a one-stop shop for you to find out real, reliable, evidence-based information as you or one of your friends or family go through their breast cancer journey. Now, I know, especially in the modern world, there is so much information at our fingertips, but it's often almost impossible to sort through what's accurate, what is complete, and what is evidence based. Now, I have been in the breast cancer world for almost 10 years now, and just want to share with you all my experiences and a lot of my education and what I've seen happen through different patient scenarios that will help you hopefully gain small bits of information that help you or your family member or friends prepare for their breast cancer journey, or if you've completed your breast cancer journey and just want to know more and kind of understand what you went through, this will be the place for you too. So I welcome you all here. I'm so excited to get started with this and to kind of let you know all the quick tips and tricks that, we're thinking about as physicians. There's a huge team that's involved in breast cancer care, and we're going to go through kind of all the nitty gritty of who you should be seeing, who's a part of your team, and what you're going to expect on your breast cancer journey, what the types of surgeries are, what are the different treatments offered, what about other pills you're taking, what should you expect to take in the future. All those questions we're going to answer in each of our upcoming videos that'll be in very, very specific topics. So first thing I wanted to do was just introduce myself and tell you, a little bit about who I am and where I come from. So I'm originally from the Midwest. I grew up there. I went to medical school there, and at that time, I wasn't really sure that I wanted to be a surgeon yet. I was trying to stay open to possibilities, but I kept finding more and more that every time I was in the operating room, time just stopped. And I was fascinated with being in the OR. I felt like it was the coolest place in the world. No one had their phones, everyone was just talking to each other, and you were actually fixing things in real time. Not to say that, recommending lifestyle changes and stuff isn't important, because it absolutely is, but I just saw, the real quick turnaround from, say, removing someone's gallbladder and them feeling better, or treating someone's appendicitis and them immediately feeling better. And I just knew that that was really special to me and something that I wanted to pursue. So, surgery, I didn't totally choose surgery. I'd say surgery chose me. I think it's very much a calling. I don't know how many people that do it that weren't called to do it. It is something that when we all are going through our medical education, we get put in the surgical scenarios, and that's really the biggest branching point in medical school when we're trying to make decisions. So it's usually, do you like procedures? Do you like surgery, or do you not? And then you go from there, because there's a million different surgical subspecialties after that. And then I set my sights on general surgery because I knew I wanted to do something with surgery, but I didn't know what. So general surgery is basically doing surgery from the neck to the toes, essentially, but you don't do anything with bones, or you don't do anything with the brain. So that's the only part that's left out in general surgery. Everything else is on the table. So I learned how to do surgery all over the body. But actually, one of my first rotations was with breast cancer patients. And I, saw women who were scared and anxious, and I saw them, being guided through by the surgeon regarding different surgical options for them. And, I saw that in my first year and was like, wow, this is so cool. I hope every surgical, subspecialty is like this. I love, getting to work with women and trying to, help them the best I can. And so, I noticed that in the beginning, but still wanted to keep my options open, and really, went through all of the rotations. I really loved vascular surgery. I really loved thoracic surgery. But I noticed I didn't feel the same patient connection that I did with the breast cancer patients. And I just kept coming back to breast cancer. I just loved it. I loved all the patients. I thought they were incredibly strong and resilient, and they were so smart and capable of so much information, and you could really educate them at the same time as treating them. And you also have a long-term relationship, which is something, that's just my personality. I like to see you for the long haul. I don't necessarily just want to do one surgery and never see you again. But that's just my personality. Again, it chose me. I didn't necessarily choose it. It was more of kind of natural inclinations. And the last thing, that I saw that really kind of hit home for me was the first time that I was like the doctor in the room, and I saw a female patient say, oh my gosh, I can't believe you're my doctor. I can't believe someone that looks like me is my doctor. And that was extremely special to me. Most of physicians classically have been men, especially surgeons. Most surgeons are men. It's classically been a very male dominated field, and I just thought, wow, if I could help women continuously and kind of see them light up like that in the future, like, I know I'm going to love my job. So that was really kind of the first thing that told me I was just going to absolutely love breast surgery. And so that was really important. And then the last aspect was I also really loved plastic surgery. So in my rotations, I loved learning all the techniques of plastic surgery. I love the artistic aspect of it. I love that you can kind of create something new or put something back together that has been, injured in one way or another. And I just loved that aspect of surgery. But I noticed that I didn't love the cosmetic part of surgery. I felt like I really wanted to help cancer patients if I could. And so when I learned about this thing called oncoplastic surgery, which is where you pair plastic surgery with cancer surgery at the same time, I, knew that was the specialty that I needed to do. So basically, once I learned about that, I spent all of my energy and motivation in residency to make my way out to California to train with one of the leaders in oncoplastic surgery, Dr. Melvin Silverstein. And I was fortunate enough to gain entry into that program and trained with him in his oncoplastic surgery fellowship. And ever since then, I have practiced oncoplastic surgery, and it's been one of the absolute coolest, most rewarding, incredible offerings that we can give to patients. And, it's just been so fulfilling and rewarding to be able to perform oncoplastic surgery for patients. So that is kind of where, the training aspect ended. And then when I was starting to go out and practice, I noticed that women were just so thirsty for this information when they were coming to see for their breast cancer appointments. And there is definitely information online, but there's so much information online. And I noticed my patients were just overwhelmed with all the resources. What's a good resource? What's not? Or the chat room, should I listen to them? What about my friend who had breast cancer? She's telling me she got this and this. And I just noticed that women were so overwhelmed with all of the possibilities and information and how to sift through it. How could they get through it, and go from there. And I'll test ChatGPT sometimes to see like if it is giving reliable information. And sometimes it is, but a lot of the times it isn't. And, even like a supercomputer is kind of sometimes lacking like that human aspect of what it means to have breast cancer, what it means to think of changing the shape and size of your breast, to think of losing a part of your body that you've been very used to having your whole life. Love them or hate them, they're a part of your body, and they're a visible part of your body. So, breast cancer especially is incredibly psychologically sensitive for people. So, that's the goal of this channel. This channel is here for you. It is here for the patients. It's here for everyone. I'm here, as best I can to help you, to answer your questions, to go through, what to expect at each phase. I'm going to have people on who are experts in their respective fields. The other thing about breast cancer is it's a team sport. Okay. It's not, your surgeon that's telling you everything to do. There are medical oncologists who control and recommend the medications. There are radiation oncologists who control and recommend the radiation. There are plastic surgeons in some cases who are recommending your reconstruction. There are geneticists who are testing if you have a gene that puts you at risk for breast cancer. It is amazing how many people are in the room there just for you. So I'm here. I'm going to explain that all to you. We'll go through it. I'm going to have people on who are experts in their field so they can explain those nuances in those situations. And we're gonna, share all this for you, so that you can take this information and, have it in your ear, look at it at 2 a.m. when you're nervous and freaking out. And we're in this together. So thank you so much for joining me. I am so honored to have you here. And please tune in because we're going to go through it. Thank you.